So I think you got at least 1 minute break. Now let's continue with our topic. I will present you one activity at first itself. Based on this, we'll start our activity for today. So you all know what class is right now, right? OBT. Okay, can you all turn on your video camera as well? Let me see everyone. Diggaz, Usang, Bhavevi, Nirvik. You got a notice yesterday telling like it's mandatory and compulsory for everyone to turn on the video camera. Only if there is a reason. If not, it will be notified to your parents. A notification to your parents means that if the camera was really destroyed, then it's maybe fine for just 1 or 2 days. For too long, if you have to work without the camera, then the class is not going to be so much productive. Just because in the name of camera, if you don't pay attention, that's a problem. So you can write that in the copy. We don't want to do all the activities in the computer every time. You can write that in your copy. So, and this, since like in the book is in a different way and we're doing it in a little different way, so that you can at least analyze that thing. So little 2-3 minutes for you to think, plus rest maybe, because before this you were having continuous maths lecture also. So just 2-3 minutes, little peace time by concentrating to work on this. Okay, it's 5 minutes already. Now let's begin. So first 5 minutes is for you to settle down and get ready. Okay, continuously, immediately after your initial class, it takes like time for you to sometimes settle down to get ready with your books or copies, because the previous teacher might be teaching you till the end of the class. So are you all now ready? Are you all ready? Okay. If nobody answers, then I feel like I'm just talking with the walls over here in my room, that you're not listening there, or either the mic is a problem. Okay, now, so here based on our topic, you can see what is the difference between profession and occupation. Okay. Now let's say it. Can some few of you say like, what do you think is the difference between occupation and profession? Let's use our thinking skills. Can someone say your answer? You can unmute. Okay, Omrat.
In occupation, we don't need specific skills and knowledge to do the tasks, but in profession, we need to study about it and know more about it.
Okay. Yeah, another person.
A profession is basically the medium or higher level of occupation. It needs a certain amount of training, skill, and knowledge, etc.
Okay. Next. And let me tell you one thing. Like when I have to evaluate your participation, and normally like from recording, or when it's recorded also, we can know who's participating. Although in my mind, I know who's participating already. Okay. but as a proof also it is there as a recording. And at the same time, whatever you write on the chat also can be like, I can download your whole chat to see what type of answers you had written. Even if I don't read in the class, I could read that later on just to see what type of answers you had written also. Although for today, okay, now Sanvi. Yes, Sanvi, you can tell your answer.
Profession is a specific job and occupation can be a variety of those.
So occupation is a, can you tell once again, Sanvi? Sanvi? Okay, Jagriti.
Profession requires more variety of skills compared to occupation.
Okay.
It requires more capabilities.
Okay, so based on this, yeah, let me just show you the difference, like how it can be understood. Like what you have told are all correct. So just basically just simple. Okay, designing a bridge or house is like a profession, whereas if it's construction of that bridge or house is like occupation also. Sometimes we can just see what he's trying to say. If you have to design that, architectures are designing, engineers are also designing, then they can more or less, you can think it's like a profession. Whereas when you start like your work is to construct it, even if engineers, you are constructing it, everything, times you can consider that as an occupation when you construct that, mainly with the masons, construction workers. Okay, so that's how it can be also differentiated. And whatever we studied about last time about basic level and basic, medium and higher level, so most of the medium and higher level jobs come under profession, because that really requires higher level of knowledge and skills, like you told, based on academic qualifications and trainings. So based on that, we can consider those type of occupations are professions. And at the same time, the occupation is also like a profession. Okay, you can tell this occupation is also a profession when that person is paid for his or her deep knowledge, specific skills and experience. So more or less it is like you told, little higher level of knowledge and skills if they have, then that is, if they are paid, that is profession. They need to be more or less paid. Just because like you can take a difference if the person is has knowledge, skills, everything, but is just doing volunteer or intern, then exactly it's not like a profession. So that's what you can understand from this. Because the student researchers, if they're doing masters, if they're doing PhD, they'll be having that knowledge. They might be doing intern, but that's not their profession already. So if, or anything occupation, whatever you've been paid for your knowledge and skills, that is more or less a profession. So if you see, I'll keep you more video links so that you can understand in variety of ways to understand the difference between profession and occupation. Although our main objective is not to understand profession and occupation, you have already done this in, I think, 6 and 7 to some extent. Our so that's how the difference has been written. So before we move on to our objectives, our first objective is about understanding about different professions. Okay, and then so that we can move on to the topic. I'll give you one link right now. Can you watch this link on your own time? I'll give you exactly 3 minutes. You watch it on your own time right now. Okay, start watching it. Let's see if it works that way. Did you all get the link? I'll give you exactly 3 minutes. Okay, it's 28 right now. I mean to say 28 minutes left in mine. It's 12:48 right now. 12:51. I'll continue. So within 3 minutes, just watch it. If you have started watching it, please raise your virtual hand, because I need to know you're really watching or not. Okay, just trying to see if it is really working out. Okay. Once you have once you're ready, then raise your hand to like start watching that on your own timing.
So I completed watching.
Excuse me, sir.
Yeah.
Sir, my video will be off because I'll go to another app.
Okay, you can watch that afterwards then.
Sir, I watched this and I'm done watching.
But I finished watching it.
Same, sir.
Okay, now the reason is like when I tell you to watch that in your own timing, if you like if somebody speaks, then I think the ones who are watching that will get confused. I mean to say they will get disturbed. That's why I told let's not talk during the time of when I tell you to watch, because others will get distracted. We really want to understand. Now those who have finished watching, please put your virtual hand up. And for a few of those who are having little technical problem, you can watch that later on in your own timing as well. But I want to really know, okay, if it's a real technical problem that you cannot watch on your own, then I'll have to screen share itself from mine. Okay. I'll only share screen most of the time when it really needs to be paused in the middle and again explained. If not, like maybe watching on your own time also, is a way of working out differently at times. Okay, but you can let me know, you can send me feedback telling sir, that way it is really a problem for me, because I'll like if you don't participate in the class, then later on you'll get lost, you'll forget, I mean, so you will not understand things. So you can let me know, okay, like someone has already told me. So if others are also finding problem in the way what I'm doing, you can immediately write a suggestion to me in Viber also later on. So that way is not appropriate for me because my technical things don't work out. Is that clear? Because immediately I'll have to start changing the strategies, thinking.
Okay, sir.
Okay, now let's continue. So that was the video just for you to understand the difference between occupation and there will be little more videos on YouTube also. I'll keep a link on my Google Classroom. So that is a video of 3 minutes. And now we have different professions. Like we saw different higher end. We are going to discuss mainly about the medium and higher level of professions now regarding the profession. So in those professions, we have profession relating to medical, engineering, agriculture, education, finance, tourism, public services. So based on this many professions, one is regarding medical profession. In medical profession, we have people like pharmacist, doctor, okay? So that's based on Bachelor of Medicine or Bachelor of Surgery, ophthalmologist, dentist, nurse, working in medical professions. So nurse is a medium or higher level profession based on what we studied. Someone can unmute and tell immediately.
Medium.
Yes, medium. That's what we so that's what we studied. Okay. So nurse is medium, and remaining you can see pharmacist, doctor. All these are medium or higher.
Higher.
Higher. Okay, so that's how.
Higher.
Okay, more. It is higher level of occupation. And in engineering also you can see different occupations. Engineers relating to civil, mechanical, chemical. Sorry for the spelling mistake. Electrical, computer, electrical again written second time. Aeronautical, okay. Architect. We have architects who are designing buildings to everything. Next, profession agriculture. And agriculture we have agriculture expert, JTA, veterinary doctor. Different people working for agriculture. In case of education, we have teacher, professor, principal. In finance sector, we have people working like an auditor, finance manager. There are many, but just in case of tourism, we have hotel managers. We have guides, we have trekkers. In case of public services, chief district officer, CDO, district education officer, DO, manager. So these are the various professions, okay, based on medium and higher level professions. So we'll be discussing about this, and you have studied this more or less in grade junior in your primary grades as well. So which grade did you study similar type of thing?
Grade 7.
Okay, in grade 7, what was the topic about and what did you study?
So it was medium and higher level profession. Like first it talked about we had lower level also. First it talked about lower level and its example, then medium, then higher.
Okay, yes. Yeah, that's, you're trying to connect with the prior knowledge of 6 and 7 to just understand the things as simple. Okay? Trying best to make it simple to connect with your prior knowledge so that it looks like you're just continuing on the basis of the thing you studied in grades 6 and 7. So to recall to you, let me remind you, when you studied in grade 7, based on like when you had to study based on sector, like there is a different way of dividing, like I told last time, based on sector, based on yes, based on various ways. Like in case of sector, medical occupation you studied, yes or no? Didn't you study medical occupation exactly in grade 7? Medical occupation, where you studied about the importance of medical science, areas of medical occupation, nursing, pathology, basic, all these things, nursing. Okay, and same way in engineering also you studied in grade 7, importance of engineering, branches of engineering, and among that you studied about the surveyor, overseer, assistant engineer, sub overseer, and same with agriculture you studied importance of agriculture, like JTA you studied, junior technician JT you studied, junior technical assistant, So it's the same in grade 7. So we don't want to again and again do the brainstorming so much of grade 7 here. That's just recalling what we did in the past. Okay. And same way in agriculture, you studied, let's say relating to forest, you studied about ranger, forester. And in finance, you studied about accountant, assistant accountant. In tourism, you studied about, you studied more or less with like cook also, even if they're cook, but working in tourism sector, okay, like in hotel, cook, guide. And finally, like in education, you studied about different places, okay, teachers. And finally, in public services, you studied about office assistant. So these are the various professions, occupations that you studied in grade 7. So do you remember that?
Yes, sir. Kind of.
Kind of, it's the same thing. That's what I'm trying to say. It's the same thing. Why take so much time thinking it so differently and have problem in that? Same in grade 6 also you studied occupation. Like you studied about the teaching profession. Let's say in education, you studied about when you had to classify it about the teaching profession. And then you studied in agriculture occupation also in grade 6. Okay, what is the importance of agriculture? Relating to engineering, you studied about construction. So these are the various things that you have already studied. So now we're going to study the almost similar type of thing that we studied, but now our objective will be based on like, will be to know a little more about this different people working in medical, like you studied in grade 6 and 7. Okay, but according to this, because our objectives are according to different that has been shown. First, we'll start with lesson. This we can consider this as a separate lesson, just the medical related profession regarding pharmacist, doctor, ophthalmologist, dentist, nurse, etc. Okay, based on this, we'll start with medical. So if we had to divide the occupation based on sector, one was the health. So on the terms of health, you can see medical falls under that. So in this profession right now, you can see they are earning, I think, almost a lot, because of in the name of corona or what, COVID-19. Even other times also they are earning. Okay, it's not they are earning only, but you can see why they are like why they earn. Okay, why do you think the medical professions normally earn, you think? Okay, it's from my perspective also, and you can think if you think the same way also. Although it's service for some of them are really doing service. For remaining, it's a very good profession because they can have good income as well. Why do you think so? People really consider health. Okay, they might not go for house, they might not go for any other sector, but for health they will pay as much as they want because they want to survive. Yes or no? So one of the reasons is they will pay enough in this sector if you can catch that sector, and if you really can do quality work, because people might stop like spending in other sector, but most of the people, they really want to survive, right? So it's same way, health is one of the very important thing also. I just wanted to relate that on the basis of right now. So you can see people spending, trying to see the latest thing. People all want to be healthy and they want to remain alive. So that's why like health is also one of the most important aspect for human beings. So for that, we have different people working in different sectors, like pharmacist, all this here. So first we'll continue with pharmacist. You have various occupation of people following different occupations over there. Pharmacist, doctor, bachelor of surgery, ophthalmologist, dentist, nurse, etc. So those are the major sectors related to health profession. To I mean to say like those are the main one of the important sectors. Now, next. I will just keep it here. Okay, medical profession related occupation. That's what we did. That's what we are going to study right now. Few of them HAs, nurse, doctor. That's what we have already seen before as well. So medical profession related occupation. You can see pharmacist, doctor, ophthalmologist, dentist, and nurse. Can you think of some more?
Sir, can you please pronounce that third one?
Ophthalmologist.
So what does that mean?
Yes.
So what does that
Have you heard of
do?
Dr. Sanduk Ruit? Have you studied about him?
Yes, sir.
What does he do?
Yes, sir.
But
Dr. Sanduk Ruit. How many of you have heard that name, Dr. Sanduk Ruit?
Yes, sir.
Yes. What does he do?
Sir,
He treats eye disease.
Okay, just wait. Okay, 2 minutes sounds and they cannot hear. Okay, one of you. Okay, Prasanna, can you tell about Dr. Sanduk Ruit?
So he is a doctor who checks people's eye, and he like many people to the people who had problem with their eyes. He helped them clear it.
Yeah, exactly.
Sir, the doctor who is called the god of sight, the same.
Yeah, that Dr. Sanduk Ruit. He is an ophthalmologist. His son is also already, I think, ophthalmologist. Sagar Ruit. Okay, he was a little junior in the same school which I studied. Okay, so that's relating to the eye surgeon. So that's we'll come to that. Okay, so you asked right now. Can you tell some more professions related to medical than this?
Anesthetologist or
Okay.
something like that.
Okay, we have different. Yeah, we have different.
Surgeon.
Okay. Okay, yeah, that's very good. Now we will continue with our pharmacist. So whenever let's you are sick or whatever and you need medicines, where do you go and buy?
Medical.
Pharmacy.
Pharmacy. Okay, where do you go to buy that medicine when you're sick? Pharmacy. And can you, like, few of you just one or two of you just write down the name of the, no, can you write down the name of the pharmacy in the chat box? Because there will be too many answers. So let's use different medium of answering. So many answers come very quickly over here. Name of the pharmacy that you remember nearby your home. And write down the location also if you remember. Either write the location close by you so that you are aware. It's just to recall you, okay? These simple things. Although the name of the pharmacy was not so much important, but it was just to make sure that you are aware of those pharmacies. Okay, I really don't care about the name exactly, but I just wanted to make sure you know where to go and take the medicine nearby. You have seen that. Okay, just for that only I was trying to ask. If not, just tell the location of that place nearby yours. Okay, so that's a pharmacy wherever you go to collect medicine. Okay, whenever you're sick or a doctor checks up and then doctor prescribes medicine also, then you go to the pharmacy and take it. There are pharmacies within the hospital as well. You go to any hospital, you go to BNB, there's a pharmacy within BNB. You go to the hospital, there's a pharmacy there. The doctor prescribes medicine or whatever you need the medicine, and then you collect it from the pharmacy. So pharmacist is also is one of the professions, okay, relating to medicine. I'll show this video right now rather than you watching it again. So based on pharmacy, and we'll discuss about this. You can watch on the screen. I'll not send you the link for now. Okay.
Hi, welcome to Cousin.
Are you all ready?
Yes, sir.
Yes, sir.
Okay, 2 minutes.
My name is Dr. Chow Fan, and I'm the pharmacist and owner of
Okay, so you know what is a pharmacy, and you've already seen a pharmacy. For that, I wanted a different person in the YouTube over there to explain about pharmacy. So the people who are working for pharmacy, I mean to say the people who are working in pharmacy normally, like the people studying pharmacy, what are they known as?
Pharmacist.
Yes, pharmacist. Okay, those pharmacists. So is one of the profession relating to pharmacy. So that's relating to medicine and health. Okay, they'll not only give you, they're not only working in a pharmacy to give medicine. They'll be also working in a pharmaceutical company to help in the manufacturing of medicine as well. Okay, so pharmacist, there are different pharmaceutical companies who manufacture medicines, okay, and they work in those pharmacies as well. Okay, if there is and they so that's what a pharmacist does. So they will, like, one of the things is they will work like a mediator between the doctor and the patient also. Like, so the first thing is, like, you can see the importance. First importance is those pharmacists work in pharmaceutical company to prepare various medications. And next thing is, like, whatever the doctor prescribes, they also help the patient to understand that prescription along with the medicine. What is the medicine and the prescription? And they also will be working, they'll be going to different hospitals, different health places to distribute the medicines so that they can educate the health people, okay, health care professionals about what that medicine is for and how is it made, composition. And they will even, like, go to doctor's place to even, like, some sort of marketing at times, even to make sure that those medicines are prescribed by the doctors. One way is like marketing, one way is like giving them awareness. Some they have to some medicines they do marketing because at the first you have to do marketing even if it is a good medicine, right? So those pharmacists also will be working for that. Along with pharmacists, sometimes they can even take someone relating to science field. If it's simple medicines, then other marketing people also are used at times. Okay, so the next thing a pharmacist does is, like I told, like they help in the preparation of the medicines, drugs, and so these are the main works relating to pharmacist. And if you have to say the pharmacist, they can study after +2. After +2, they can study directly bachelor's in pharmacy, but directly from SLC also they can go. Like let's say they have studied SLC, then after SLC directly SE, they can join diploma in pharmacy, that is pharmacy assistant level. And to do that, they need at least minimum qualification grade C in grade 10. If not, they are not allowed. And they have to study for 3 years. And next is after +2, like you study 11 and 12, then you can join B.Pharm, okay, Bachelor in Pharmacy, after grade 12 science, or either diploma in pharmacy, and that course is for 4 years. And in that subject, you'll be studying, of course, relating to science type of thing. In science, like you studied chemistry, zoology, botany, health education, healthcare system, first aid, pharmaceuticals, biochemistry, microbiology. So this type of this type of things will be taught in pharmacy, so that they can take decision of like medicines, like how much dose is required, how to prepare them, and when they have to educate the health people as well. Okay, anything about pharmacy and pharmacist? Okay, I'll keep the assignment in Google Classroom for now. I think it's already time up. I also exceeded by 5 minutes, although I have it's still 1 minute left for my 40 minutes to be over, because I started late. I cannot take another teacher's class. Okay, in mine it's still like 2 minutes left to end 40 minutes ago.
Bye bye, sir.
Okay, yeah, thank you so much. Thank you.
Bye, sir. Thank you, sir.